Okay, so we're going to move on, and you guys will know uh, Kimberly very well. Kimberly Tan graduated from the Philippines in 2013. We had her on last year for the ophthalmology talk, which went down really well actually, and we got some really good feedback. And we're so glad that we can get her on board today, because I do not think that anybody else can explain the ophthalmology pathway application side of things better than Kimberly. She's a pro at what she does. She knows exactly the steps that you need to be thinking about, the challenges, the hurdles, and I'm sure we're going to hear about all of that at some point today. And of course, also co-founded the Savvy IMG with Nicholas Tan. And we're really lucky to partner with these guys, and they do some super stuff for IMG doctors. And I'm sure a lot of you guys already know them and you've used all their blogs and gone through all of their material and their courses, but please do check out the Savvy IMG, because they are a real benefit to us guys in the medical world, especially to the international medical graduates. So Kimberly, thank you so much for coming back on board again. I'm looking forward to your talk.
Thank you so much for inviting me again. Thank you for the introduction. All right, so I'm going to talk about a career in ophthalmology in the UK. And I just want to get straight into it. There's quite a lot that I wanted to put in the talk, but I only have 30 minutes, so I hope I can give you guys the most useful and the most practical advice that you can start using so you can get into this wonderful specialty as well. So there are three main parts to it. First will be about my own journey, and I won't spend too much on this. I'll talk about ophthalmology as a career as well, and then I'm going to do the bulk of the talk about how to get into ophthalmology training, so those practical steps that you can start taking today. And just as a disclaimer, this is a simplified overview. It is only 30 minutes long. I hope you see it as the beginning of your research into the specialty and into how to get into UK training. But there is a lot more to read. So we do have more articles on our website on the Savvy IMG, and we also have a specific article or guide for IMGs to get into ophthalmology. So there is a comprehensive guide on the website, and I hope you guys can check that out if you have any other questions. I hope that it answers most of them. So just my own personal journey. So I was born in the UK. I lived here until I was about 13, and then in 2001 my family moved to the Philippines, so that's where I did all my higher education. So my first degree was in BS biology, and then I did medicine as a postgraduate degree, and I graduated in 2013. And then from 2013 to 14, I was going through my whole GMC registration journey and applied to the foundation program. And for me, that did include an IELTS test and PLAB and all of that stuff, good stuff. So 2014 to 16, I did the foundation program in London. And then from 2016, right after finishing my foundation program, I started my ophthalmology training, and I've been in the South London Deanery since 2016, working currently at King's College Hospital. So I want to talk a bit about ophthalmology as a career for any of you who haven't thought about it as a career yet. Just give you a bit more insight, because I definitely did not think I was going to be an ophthalmologist when I went into medical school. I thought I was going to go into neonatology, and I didn't even consider ophthalmology until probably after I graduated, or maybe just towards the end. So I think the main reason for that is because I just didn't know much about it. We don't focus on ophthalmology in medical school, in my school at least, and I think in most schools. So let's talk a little bit about what it's really like, and maybe you'd be interested. So the nice thing about ophthalmology is the diverse pathology. So there are things that are benign, things like conjunctivitis, corneal abrasions, dry eyes, cataract, things like that are very common. But then you can also get conditions that are sight-threatening or can cause blindness, like infections, angle closure, glaucoma, uveitis, retinal detachments, and all of these require immediate treatment it could be drops, oral medications, or even surgery. And in ophthalmology, we also see a lot of patients with life-threatening diseases. So they can present with ocular signs and symptoms, and they can come to us, but their underlying diagnosis may be TB or sarcoidosis, stroke, endocarditis, etc. So it is not just about the eyes. You do have to have a good background, a good grounding in medical knowledge as well. So it is very interesting in that sense. In practice, I would say that it's a very rewarding specialty because a lot of the interventions we have are very effective, and some people can go from blind to seeing 20/20, and to be able to have that impact on someone's life is very, very rewarding. It's also a variety in the work week. So there is some medicine, there is some surgery, you do laser and all of this. So there's a lot of things. It's not just ward work 24/7. We have a lot of different activities in our professional timetable. One of the nice things about ophthalmology is that it is mostly office hours. So, you know, you start, sometimes you can start at 8 or start at 9 and then finish around 5, sometimes 6 if it's a busy clinic, but we don't have lots of night shifts. We don't have a lot of evening shifts. So in that sense, it's very family friendly because you can easily create like a part-time working schedule because of the way that, you know, the work week is. It's also very high tech. We have lots of research going on into both the medications and also surgery, imaging, all of these things. So ophthalmology now is very different from how it was even just 15 years ago. And in 15 years' time, it's probably going to be very different. So if you like a specialty that is fast-paced with lots of new developments, then ophthalmology is definitely one to consider. And we are very busy. In fact, the ophthalmology as a specialty sees the most number of outpatients in the NHS. So we have a very heavy workload and it's always going up. We're always getting busier. And that's because a lot of the conditions we see are age related. So cataracts, glaucoma, vein occlusions, things like that, they all increase, or the incidence increases with age. So we are getting very busy. So you're never going to be without a job if you want to go into ophthalmology. Just to give you an idea of a typical timetable. So this is a timetable as a trainee and at ST3 level. So this will be a little bit different from a consultant or a specialist doctor, but as a trainee, this was my timetable last year or two, just before the pandemic. So, you know, it's a mixture of clinics, there's some theatre. CPD is time to do audits, research, and catching up with journals and things like that. So my whole Thursday, I had to do that. I didn't have to go on site at work. And then we have teaching every week on a Friday afternoon at King's. And yeah, it was a very varied timetable. I worked with lots of different consultants and you learn so much through this. I, of course, do evening shifts sometimes. That's once every 8 days, I think it was. And then I do weekend shift as well, which was, I think, once every 6 weeks. So not as heavy as ward-based specialties that can be doing weekends like every 4 weeks or even every 2 or 3 weeks. So yeah, it's definitely a lot lighter in terms of hours from that sense. So what about ophthalmology training in the UK? So there are 2 pathways if you want to enter the training program. So there's the CCT pathway and then the CSER CP pathway. But both of these pathways lead to getting a certificate of completion of training, which is a CCT. And the only difference is how many years in the training program that you complete and the entry point. So on the CCT pathway, you complete the full 7-year program. So you enter at ST1, which means Specialty Training Year 1. And that pathway is only open to those who have less than 18 months experience in ophthalmology. So if you've never done ophthalmology before, that's where you'd be entering. Now, if you've done more than 18 months of ophthalmology already, then you would no longer be eligible for ST1. But that's why you can then go onto the other pathway, which is a CSER CP pathway. And that's when you enter at ST3 and you complete 5 years of UK training and you get the CCT as well. So ST3 expects you to have at least 24 months ophthalmology experience. You must have passed the FRC Opt exam part 1, and then you must have done at least 50 phaco or 50 cataract operations independently. And in the UK, as trainees, we do get a lot of surgical experience. Before I entered ST3, I had done about 200 plus cataract operations. So it is surgery heavy. So how many places are there in ophthalmology? At ST1 level, there's about 70 to 90 each year. and the competition ratio is between 4 to 6. So what that means is for every available place, there are about 4 or 6 people applying, 4 to 6 people applying. For ST3, it's quite variable. Some years it was closed, so there were 0 places, and then some years they open it, and when they do open it, it's usually around 20. It's a little bit less competitive with 3 people applying for every position, but that's still considered quite competitive. And my training program director mentioned that they may be closing ST3 entry in the future. So I think your best bet if you want to get into ophthalmology is to aim for ST1. So if you're interested in ophthalmology, how do you get in? So how do you get into UK training? I just want to mention my personal experience applying to UK training as an IMG. It was very stressful because I had to deal with a lot of doubt. And it wasn't just doubt from myself, like doubting myself that I could get in as an IMG, but I had that doubt kind of reinforced by everybody around me, saying that, you know, as an IMG, as Alia just said, you know, people telling you to be realistic, that you should consider other specialties, and that was kind of that was what I was hearing a lot as well, especially because ophthalmology is not just a competitive specialty, but I wanted to get into London because that's where my family is, and it was a very competitive location. So I did get some people, like, they didn't roll their eyes, but I could see them thinking it, rolling their eyes, because they thought I was being too ambitious. But I took that as a challenge, and I thought, well, people do get in, so I don't see any reason why I couldn't. And I did. So I applied and I got in on my first application. Everyone was telling me to be prepared to apply 2 or 3 times even, but I got in on my first application. I ranked 96th percentile, so there were about 430 applicants, and I was in the top, well, I was 19, I think, at the time. And I got into my first choice location in London. And I'm really glad that I put London as my first choice and didn't go with their advice of putting somewhere else. Otherwise, I would never have gotten into London. So I really hope that by now, you know, I'm second to last talk today. You've heard so many IMGs with their inspiring stories. I hope that you believe now that IMGs really can make it. And you really should cultivate this positive mindset, because there are no barriers to you getting into specialty training. Especially since the immigration rules changed in October 2019. So UK graduates and UK residents are not prioritized for applications to specialty training. As an IMG, you have equal chances to get in. And the only thing that will separate you from other applicants is your application score. So if you have a good application score, you will get into training. It doesn't matter where you went to medical school or what your passport says. So it's about your application score. And if you're thinking, okay, that's all great, but it is a very competitive specialty. Yes, it is. But what does that mean? It just means that you'll need to work harder, you'll need to prepare earlier, and you need to be organized and strategic with your resources. So if you're thinking about your time, your effort, your money, you just need to be very organized and strategic about how you allocate those things. And if you do that correctly, then you can get a very good score, and applicants are selected based on their score. So for ophthalmology, the components of the application score are the MSRA, that's only for ST1, not for ST3, the portfolio, and the interview. So the MSRA is, I'm sure it's been discussed before. I'm just going to let you know how it's used in the application for ophthalmology. So it is the basis for shortlisting applicants to proceed to interview. So if you don't reach the cutoff score for the MSRA, then you won't be able to proceed with your application. You won't be invited to interview. That's one way it's used in the application. And the second way is that it is a percentage of the final application score. So I'm not sure the percentage this year, but in the past it's been about 20%. How to prepare? I recommend Aman's preparation materials. There is clinical knowledge and there is situational judgment, and these are both things that he can definitely help you prepare with, and I recommend to look into those. For the portfolio, it is used in your application score as a percentage of your final score. So definitely need to do well in that. There are different components of the portfolio depending on if you're applying for ST1 or ST3. So on the screen now, you can see the components of the portfolio for ST1. So you have qualifications, prizes and awards, commitment to specialty, presentations, publications, teaching, etc. All the things that you've heard a lot of other speakers talk about today. For ST3, it's generally quite similar, but there are two main things that are different from the ST1 application, and that is the first one, which is an essay. So you have to write why they should choose you to start training in the UK, and you get only about 400 words, and you're given 20 points. So it is the biggest component of the portfolio. And then second is the clinical skills and experience. So since you're applying to ST3, you're expected to have ophthalmology skills and experience, and that is 10 points in the portfolio. So how do you do well in the portfolio? So my top tips for ST1 is to really hone in on the commitment to specialty, because it is a quarter of the portfolio score. So you should be aiming for a perfect score. I don't think it's that hard to get a perfect score, because they tell you what gives you the score. For example, doing a taster week, doing an elective, publishing a case report, attending conferences and courses. You can do all these things and it will get you a good score for your application. And the second thing is that the rest of the portfolio, like prizes, other types of publications, presentations, audits, these don't have to be ophthalmology related. My quality improvement project that I had in my portfolio was in orthopedics, and I managed to get a perfect score in my ophthalmology application, because it's not just about ophthalmology, it's about those skills that you learn. And doing an audit, if you can do it in one specialty, you can do it in any specialty. So wherever you are now, whatever specialty you're in, you can do an audit or quality improvement project in that specialty and submit it for ophthalmology. Top tips for ST3. I would advise you to, once you write your essay, to have it reviewed by a consultant ophthalmologist in the UK. They can give you pointers on how to improve. I would also remind you to keep a log of your procedures and download all these assessment forms and complete them. So I've given Aman and Pooja a handout, and there are links to templates that you can use for a log of your procedures and all these forms that I've mentioned here, and they're quite self-explanatory. So once you go through them, you'll know exactly what to do. So overall strategy tips, just like Alia said, the first thing you need to do is score yourself now, because that will give you a good idea of where you are at the moment and how far you need to go. Then you need to set your goals. So what's your score now? What score do you want to aim for? I always aim for a perfect score. You don't always get a perfect score, but if you aim for perfect, you might get somewhere near it. And then evaluate the resources you need. So for each of those activities, how much time do you need? How much money is it going to cost? And how much effort do you need to put into it? You need to then focus on the less resource intensive things first. So things that don't require any money and just require your time and effort, prioritize those. For example, doing a clinical attachment or doing a taster week. That's free, that's easy, and you should do that first. And then do the things that are more expensive and more time consuming and more requiring of effort later on, like doing an additional degree and things like that. So I'll do those last, to be honest. And then create a feasible timeline. So you go from the least resource intensive activities all the way up to the more resource intensive ones over time. And I would recommend starting now. Because again, as Alia said, whatever you do overseas counts as long as you have the correct evidence. So if you're a medical student overseas, you're an intern overseas, you can start right now, get the right evidence for it, and that will count in your application score. So I did that, just scoring myself and then working towards improving my score. So when I started, I had a score about 5 out of 50, but then within a year, I managed to improve that to 38, which helped me get my training position. So it's definitely doable. but I think the difficult thing is knowing how to choose your steps, how to lay out your steps in your plan. So Nick and I, we came up with this IMG Masterclass. So this is a course that we run, and it is a premium course. It is a paid course. There's about 12 hours of video, 80 plus videos in there, going through everything step by step. You can find most of the stuff we talk about online through Google, but I know how overwhelming it can be. So we try to put everything all in one place so that you can just follow one resource. So if you're interested in that, you can check out our website. We are giving away a 15% discount today with the code IMG15. So yeah, if you're interested, have a look. And then the final component of the score is the interview. So it's a virtual interview since the pandemic, and there's only one station, which is a communication station. So this involves, it's kind of like PLAB 2. There will be an actor simulating a patient or a patient relative, and then you'll have to manage the situation. Usually it's an angry patient or an angry patient relative. That's what I had in my interview. And because it's a very challenging situation, they want to know you can deal with. So you do need, so the score for the interview is part of the final application score, of course, and you need a minimum score in order to get through. So if you do really badly in the interview, even if you have a good portfolio, even if you had a good MSIA score, you may not still get, you may not get through to training. So you have to do well in the interview. My top tips, as with anything that is practical, you need to practice, practice, practice. Aman has some communication skills, resources that you can go through. They're very much applicable to this part of the, they're very much applicable to ophthalmology as well, because it is a communication station. So yeah, those were the 3 parts of the application score. And that's really the end of my talk. I wanted to keep it short and sweet. But I do want you to know that it is possible to get into the UK, as this whole conference has shown you. Don't overcomplicate things. It can be simple. It can be as simple as checking your score now, working on your portfolio, and getting in. But do keep up to date with the latest guidance, because it changes each year, and try to prepare as early as you can. There's nothing wrong with starting now. I think that gives you the best chance. So yeah, that's me.
Thank you, Kimberly. That was really, really good, as always. Yeah, as always, to the point, high quality, just really useful information that cuts out all the clutter. And I think that's what you do in your main course, isn't it? Cut out all the clutter, all the noise, and get down to the point. And that's why people should definitely check out the stuff that you do. And I know lots of people get value from it already anyway. But yeah, some questions coming in. It might be worth just doing 1 or 2, because we're okay for time, I think. Pooja?
Yeah, absolutely. So Kimberly, someone's asking, do you recommend any places to apply for clinical attachments in ophthalmology particularly?
So Moorfields does have a clinical attachment program that you can apply for. It's quite structured. That one is paid, however. There are some other hospitals that do it for free. So where I worked for before, Epsom and St. Helier Hospital, they'd be very happy to have observers. I think at King's College Hospital, where I work now, they'd be quite happy to have observers as well. So yeah, just keep trying. I think most hospitals do have an ophthalmology department. So yeah, and ophthalmology people are very friendly. So yeah, I think they'd like to have anyone who's interested in ophthalmology. They always welcome people who are keen.
Oh,
Great, there's a couple more. But do you want to hand these over to Kimberly directly? Then we'll get on to Pete. Or do you want to ask another couple?
I'll just ask one more and then I'll hand them over. But anyone who has listened to Kimberly speak, as she's mentioned, please check out their IMG Masterclass course. It is definitely well worth it, and it gets you ahead of your peers. As you've seen with Kimberly, they have the right attitude and they certainly know how to help other IMGs. So please check it out. Kimberly, someone's asked, does the publication have to be in the ophthalmology field specifically, or does it help if it's a publication regardless?
So if it's a case report in ophthalmology, that will count towards the commitment to specialty part of the portfolio. So you get up to 4 points for case reports. But other than that, if it's a review, if it's research, it doesn't have to be ophthalmology related. Any publication will be counted in the publication section.
Bro,
Awesome.
that's really useful. So yes, Kimberly, if it's okay, we'll allocate a few questions to you. They are a bit more individual and specific to people in particular. So I'll forward those across if you're okay to stick around for a few more minutes. But thank you
guys.
so much.
Thank you so much, Kimberly.
for